Good afternoon. Today we will say about some renal conditions. The first one is glomerulonephritis. Inflammation and destruction of glomeruli of both the kidneys is an glomerulonephritis. Etiology group A, group B, hemolytic streptococci. Signs and symptoms gross hematuria. Gross hematuria in the sense there will be a dark smoky color urine, oliguria or anuria, facial, periorbital and generalized edema, increased BUN level, and serum creatinine will be increased. Interventions, we want to check the monitor of vital signs. The patient will be mostly hypertension. Intake output of the patient to be recorded. Restrict the fluid diets, high calorie intake, low protein and low sodium diet. We want to administer diuretics to the patient. Monitor the signs of renal failure, RTI infection, check for streptococci infection like streptococcus group A or group B infection in a respiratory tract infection. Nephrotic syndrome, here there will be a protein loss for the patients, protein in urine, hematuria, edema, anemia, hyperalbuminemia are common signs and symptoms we can see in nephrotic syndrome. Interventions, check the vital signs, again intake output, adequate bed rest, avoiding trauma because the patients are high risk for bleeding, hematuria, administering antidiuretics, antihypertensives, plasma volume expanders. Third one, polycystic kidney disease, hypertrophy and formation of cyst of the kidney tissue resulting from necrosis and scar tissue formation. Signs and symptoms, headache, flank pain, which worsening while activity, urinary tract infection, hematuria, proteinuria, pyuria, calculi, hypertension. Interventions, monitor for hematuria, increase IV fluids after antibiotics and administer antihypertensive medications. Prepare for subcutaneous cyst puncture. Prepare the patient for dialysis or renal transplantation. Acute renal failure. When a patient suddenly gets renal failure, it is an acute renal failure, such as the patient's creatinine will increase, there will be anuria or oliguria, and BUN will increase. Pre-renal conditions, due to reduced renal blood flow, decreased cardiac output, DVT, diarrhea, vomiting, and diuretics are not being taken properly. Intrarenal parenchymal changes by disease such as nephrotic syndrome or nephrotoxins, trauma, surgery, infections. Postrenal, postoperatively there will be obstruction in the urethra and bladder. Phosphorus 4, calculi and tumor formation. Signs and symptoms, oliguria, anuria, hyperkalemia, hypernatremia, acidosis, anemia, platelet dysfunctions, edema and hypertension. Treatment, diuretics, antacids, recombinant erythropoietin for anemia, antibiotics and dialysis. Interventions, same, we need to give and we need to monitor the strict intake output for the patient. Chronic renal failure, when the patient is slowly progressing about a kidney disease or renal failure is an chronic renal failure. Signs and symptoms, anasarca, where the patient whole body will be having edema, azotemia, nocturia, anemia, hypernatremia, hyperkalemia, oliguria, tetany, Cosmol's respiration, which we can see in a diabetic ketoacidosis, proctitis. Management, diuretics, erythropoietin, antihypertensives, dialysis, kidney transplant. Continuous or long-term immunosuppressants we will give to the patient. Interventions, we need to monitor the intake output, weight of the patient, vital signs, frequent skin care, positioning, range of motion exercise, strict IV fluids, complete bed rest and prepare for dialysis. BPH, benign prostate hypertrophy, gradual enlargement of a prostate gland, construction of an urethra leads to the interference in urination, hydronephrosis and urinary tract infection. Signs and symptoms, urinary frequency will be very high, nocturia, cystitis, hematuria, calculi, nausea and vomiting. Nocturia, urine passing in night time multiple times. Treatment, finasteride, prazosin and antibiotics. Surgical management, TURP, transurethral resection of prostate. Preoperatively, we will increase the patient IV fluids, administering antibiotic, application of heat to relax the sphincters. Following to the postoperative care, we will go for a cold compressor, observing the hemorrhage, bladder irrigation, ICP to be monitored because of intercellular fluid volume exchange. Aseptic technique to be followed. If ever we will notice the bleeding, we need to give a sterile gauze, gentle pressure, following to the inform to the surgeon for the surgical management. Hemodialysis, it is a replacement of an kidney functions done by a mechanical machine where we have multiple catheters, temporary and long-term catheters. Temporary catheters like non-tunneled catheters, subclavicle, jugular, femoral we will insert, and then long-term catheters such as AV shunt, AV fistula, AV graft, all those things. Complications, disequilibrium syndrome. Due to the sudden exchange of all the solumen, the patient will end up with cerebral edema and confusion. Atrial steal syndrome, the patient will look paler, vascular insufficiency, and pulse will be painful and weak pulse. Hypertension, cardiac dysarrhythmias, potassium imbalance, air embolism, hemorrhage for heparinization. We need to monitor the bleeding, we need to prevent the clotting. We will do the patient with a proper circulation, and then electrolyte imbalance to be monitored. We will promote the patient comfort and diversional activity. Peritoneal dialysis, contraindication, peritonitis, recent abdominal surgery, diverticulitis. Continuous ambulatory peritoneal dialysis and automated continuous cycling, intermittent cycling and nighty cycling. Continuous will be happening for 24 hours. Nighty will be like only in the night time. Intermittent every 8th hourly the dialysis will be done. Interventions, we want to monitor the weight, and always the output should not be more than the input. At least it should not be more than 400 ml. We want to check the wellness of the patient. If there is any oozing, bleeding, we need to notify to the doctor. We need to check the electrolytes of the patient whenever we do this. Interventions, we need to check vital signs, respiratory distress, infection, oozing, and report the inflow and outflow. Medications during use dialysis, erythropoietin, calcium, iron supplement, phosphate binder, vitamin H2O solubles, antibiotics, antihypertensives are held prior to dialysis. During or after dialysis, we will give the antibiotics. If blood cultures or the site culture, we need to take before the dialysis. Activator, vitamin D3. Important points to remember: chronic and acute renal failure, nephrotic syndrome, complication of hemodialysis, phases of peritonitis. If any doubts, please contact us. Thank you.